you use your 2 fingers at the carotid pulse, and I want you to count for me as I check for the circulation for 10 seconds. And 1,
and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10.
Good. Now, circulation present. Breathing, you look and listen. For how many seconds? 10. Start counting.
1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10.
Now, breathing is absent. So immediately you proceed by giving 10, initially 10 ventilations. And how do you give ventilation? 1 full breath should last for 4 seconds. 1 full breath should last for 4 seconds. Before you give the next breath, you should rest for, 1 full breath should last for 2 seconds. And before you inflate the next breath, you should have a break of 4 seconds. And how do you count? How do you know you're having those breaks? This is how you go about it. First of all, making sure the airway is open, you seal the nose with your other hand, so that when you inflate, the air does not escape. It's just like the way you breathe in. And then it will come out as soon as you give 1 full breath, you release, like this. And you know, if the chest does not rise, just know that that breath is not enough. Don't do something like this. Okay? Is it rising?
Yes.
So, how will you know that you are giving 1 full breath? The chest must rise. And how will you know that you have to rest for 4 seconds? This is how you count. For example, I want to give like 10 ventilations. Okay. I count like this. 1, ABC. 2, ABC. 3, ABC. 4, ABC. 5, ABC. 6, ABC. 7, ABC. 8, ABC. 9, ABC. 10. You don't say ABC, because if you say ABC means there's an 11th one coming. This is why I'm saying ABC is saying 1 ABC. Those are 4 seconds. Then you say 2 ABC. It's easier that way rather than counting 1, 1, 2, 3, 4, 2, 1, 2, 3, 4. You'll get confused even before you reach the 4th breath. Are you together? Now, after 10 ventilations, you check for circulation. Start counting 1,
And 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10.
Circulation is not there. So in that case, you give again how many ventilations? 2. I want you to count for me those 2 ventilations.
1 ABC. 2 ABC.
No.
2
Just 2. Okay. If you say 2 ABC means I should continue. Okay. I'll repeat.
1 ABC. 2.
Good. Now you locate the heart. You locate the heart of a casualty who is lying in this position by putting your 2 fingers on the rib cage. You run them on the rib cage up to there. Then the heel of your arm, you place it on top of the index finger, like that. Another way is using your thumbs like this, like that. Where they meet, you turn. The one on your left, you put your heel of your arm there. So in this position, you are ready to give up to 30 chest compressions. So in this position, fingers must be interlocked. Okay? Let me use my left arm like this. It's okay. Fingers must be interlocked, and then the elbows should be straight, like this. So we want to give up to 30 compressions at the rate of 100 per minute and the depth of 1.5 to 2 inches or 4 to 5 centimeters. Are you together? I repeat, the rate of 100 per minute and the depth of 1.5 to 2 inches, which is equivalent to between 4 and 5 centimeters. So you start giving compressions like this. Are you counting? I don't know how many, yeah? Oh. Then you go back here, 2 ventilations. 1, ABC. You continue like that until number 1, help comes, until number 2, you are physically exhausted, or number 3, there's someone to relieve you. Okay.
If you are just alone, when you are exhausted,
I said, I may be physically exhausted.
yes.
Then I'll stop doing it. Okay. Are you together? But do not leave a casualty unattended. If there's somebody around, you can. And in most cases, when you're alone and you get a casualty lying somewhere, the first thing you have to do after assessing danger, you shout for help. Help! Are you getting it? Someone may be passing there and and shout, help. They may be curious to come and see what's going on. So when they come, you can use them as bystanders to help you to go and call for help, or to do some treatment as the way you want it. Are you together? Questions?